Hi, I'm Erica Collier. I'm a senior, and today's scenario is to enter your patient's room and follow appropriate red rules, prepare soap suds enema, and verbalize administration, but do not infuse the solution into the mannequin. The patient is unable to ambulate to the bathroom and is verbalizing the need to stool post-enema, and demonstrate a complete bed bath on this diabetic patient with dentures.
Hi, my name is Ashlyn Walls. I'm a Liberty nursing student. I'm going to be your nurse for the day. If I could just have you repeat your name first and last and your date of birth for me. All right, thank you, Mr. Jones. So today what we're going to be doing is I'm going to be starting you off by doing a soap suds enema. So what I'm going to have you do is I'm going to go over here and prepare your enema, and I'd place this soap suds in the water solution anywhere from 500 to 1500 cc's as prescribed by the doctor. And then what I'm going to do is I'm going to have my assistant come over. I'm going to lubricate the top of the enema about 2 to 3 inches, and then insert it, since you're an adult, 3 to 4 inches into your anus. And for children, we're going to insert it 2 to 3, and infants 1 to 1.5 inches. So what I'm going to do is we're going to roll you over into the left viral Sims position. I'm going to grab the enema, have the solution placed in it, as I said, lubricate it, and then stick it 3 to 4 inches into the anus. And then we're going to keep the enema bag up and whatever the doctor prescribes, low, medium, or high. High is going to be 18 inches, medium is going to be 12 to 18 inches, and low is going to be 3 inches. And then we're going to have him stay like this with the enema bag on the IV rack or holding it up until the solution has been emptied, and then we're going to ask the patient to keep the solution inside for 3 to 5 minutes if he can hold his bowels. And then what we're going to do is we're going to place him on a bedpan. This is what we're going to do. See if he's comfortable. I'm going to roll him over to my side. If I could have you pull it through a little more. Excellent. You're comfortable, Mr. Jones. We're going to cover him up. We'd close the curtain, give him privacy, elevate his bed so that he felt like he could have a bowel movement. Close the curtain, give him privacy, come back after he has done his business. And we'd come back, remove the bedpan. Courtney. Alright, if I could have you hold him over. Make sure to hold the bedpan down so that I do not have any contents get on him. Make sure his bed pad is fixed properly. And now what we're going to be doing is performing a bed bath to help clean him up after he's had a bowel movement. So to start that, what I'm going to do is I'm going to take the bath towel and place that on him. You can go ahead and remove the top linen as well. Alright, now we're going to go ahead and remove the patient's pillow, place a towel under his head, and place a towel on his chest after I removed his gown. And a bed bath would be done bilaterally. We're just going to do it on one side of his body for right now. Okay, so I'm going to take the basin, fill it up about 2/3 full with warm water that's comfortable for the patient. I'm going to go ahead and get my rags ready. Make a minute. Alright, we're going to start up at the top of the head. Before I performed his bed bath, I'd perform hand hygiene. And what I'm going to do is I'm going to take the rag, dip it into the water, go from the inner to the outer canthus of his eyes using the different corners of the rag, and then wash over the rest of his face, and then the front of his neck and the back of his neck. Alright, then I could change my rags to a new washcloth. We're going to move on to his arms. We're looking at his fingers first, going from distal to most proximal. Top of the arm, bottom of the arm. At any point, if the water becomes too cold, I could change the basin. Again, this would be done bilaterally. Then we could clean his chest. All right, and then we move, change rags, soak the water in the basin, move down to his feet. Starting in his feet, cleaning his toes in between them. And since this patient is diabetic, we do not want to be soaking his hands or his feet for any extended period of time. Cleaning both of his legs in the front and the back. Next, what we're going to do is I'd take the patient and I'd flip him over to his back. And at this point, I would change my washcloth again, or at any point that it becomes soiled. So the patient would be raised in bed. And I'd clean his back, and the back of his shoulders, back of his neck. And at this point, I would clean his anus and his perineal area, and I'd change rags, clean his anus, wiping from the front to the back. Same with the perineal area. We're going to use a different rag for the anus and a different rag for the perineal area, just making sure that no bacteria is transferred. And as I clean the perineal area, we're going to clean again from the front to the back, making sure that there's no fecal matter after his enema or anything left on him. Alright, we're going to dispose of all of the rags and to the dirty linens. And cover Mr. Jones back up. And from here we're going to go on and we're going to perform denture care. So what I would do is I take the dentures out of Mr. Jones' mouth, and I'd perform hand hygiene before, after the bath, before I remove his dentures. Take his dentures out, place them in the container, take it over to the sink, place a rag at the bottom of the sink, have warm water running, take the dentures out, clean them, and if the doctor has prescribed any paste for the dentures, we'd use the paste on the dentures to clean them with. Place them after we've rinsed them with warm water, place them back into the container with cool water. And if the patient does not want the dentures back in their mouth, we keep them in the container and initial it, sit with their initials so that the dentures wouldn't get thrown out. And then we could come over, ask the patient if they want them back in their mouth or not. We could clean their teeth, perform oral hygiene, making sure that there's no fixative on their teeth. And then if they want them back in their mouth, we could assist them in placing the dentures back into their mouth. And that's it.